Partners Personalized Medicine is focused on helping physicians, genetic counselors, investigators utilize and translate the expertise of the human genome into clinical care.
It's really about how can we discover the core causes of disease in an individual that may be very specific to that individual, and then figure out what treatments really work best for that patient based on the genetic underpinnings of their disease.
Partners Personalized Medicine is leading in the kind of research that it's going to take to integrate discoveries in genomics into healthcare, from variant discovery and characterization in the laboratory to actually using the information with doctors and real patients.
Whether you're a clinician, a nurse, a genetic counselor, a patient, a researcher, all of the various components of the center are linked, integrated, and available to all of these different potential clients.
The Laboratory for Molecular Medicine is a clinical lab that does translational genetic testing. So we look for new discoveries, new genes that cause diseases, and bring them into clinical testing, into clinical use. We're really being able to bring not only targeted tests to patients, but also exome and genome sequencing that allows us to take a completely unbiased look at a patient's genome to try and find what is potentially causing not only the disease that they came in the door with, but also anticipate risks for diseases they never even thought they had risk for. We work closely with all of our colleagues in the clinical care system, with the researchers at Harvard Medical School and our affiliated hospitals, Brigham and Women's Hospital, Mass General Hospital, to really not only offer a test, but really offer a lot more than that to a patient, offer a better understanding of their results, better direction to how their care should be modified to use that information and improve the outcomes of patients.
Clinicians need clear, concise, information-dense, and patient-specific reports. And our infrastructure makes it possible for laboratories at high throughput to consistently generate those types of reports that make it easier for clinicians to incorporate genetic testing into their clinical processes. And then we also have the ability to keep them up to date as our laboratory reclassifies variants in potentially clinically meaningful ways that have been previously identified in their patient population.
Working with the Translational Genomics Core, researchers will find the opportunity that, in addition to the basic services such as genotyping, microarray, and next-generation sequencing, we offer support and guidance on their projects, and we help them think about how to set up their projects, as well as think about the tools necessary for analysis. And we also work with the bioinformatics team here at Personalized Medicine to see if we can provide additional analysis and support for researchers.
We're on the cusp of this sort of giant explosion of genetic information that's going to be brought in clinically. So you need tools that you can develop and that you can incorporate to be able to really dive into this information and pull out the key components. Bioinformatics fits well with the Personalized Medicine Initiative here at Partners Healthcare because it enables us to really bring in a lot of different sources of information and to merge that with a lot of the biological data that we're finding. It makes the interpretation process here much more efficient.
Partners Healthcare has actually been at the forefront of the use of electronic health records for medical research, and also in the realm of genomic medicine and genetic research. The biobank actually puts these two things together and makes them accessible to the research community in a way that can really catalyze discoveries. It's a real partnership between the research community, clinicians, patients, families, all working together to improve the health of our community.
Partners Personalized Medicine offers an extraordinary range of educational possibilities at the medical school level, the resident and fellow trainee level, and across the faculty in terms of case conferences and educational lectures. So it's really spanning the gamut in trying to train our current doctors and our future doctors about how to apply genomics to the practice of medicine.
We're really, I think, helping to lead the nation forward in a lot of our endeavors because we're really pushing the boundaries of what is being incorporated into clinical care.
patients come in with a lack of understanding of what is causing the symptoms and the illnesses they may have. And by doing sequencing, we can give them answers. And that's the part of my job that is most rewarding, because I can really see how I can make a difference in patients' lives.
As the director of Partners Personalized Medicine, it's an unbelievable privilege for me to be involved with the 200 people in this program translating genetic and genomic findings into clinical care.